About 26,500 people in the U.S. will be diagnosed with stomach cancer this year, but the risk is even higher for Americans of East Asian descent. In countries like Japan, China, Chile, and Iceland, where they screen for stomach cancer, the numbers are even higher. Dr. Haejin In, a surgical oncologist at Rutgers Cancer Institute of New Jersey, explains why this is and what people of East Asian heritage can do to manage their risk. In terms of stomach cancer risk, Koreans are 13 times more at risk compared to white Americans. Vietnamese are at 7 times, and Japanese and Chinese are at 5 times the risk. This pattern is also seen globally, with certain countries having much higher rates of gastric cancer. Gastric cancer is particularly prevalent in minorities, with the mortality rates for gastric cancer in blacks, Hispanics, and Asians being double that of whites in the United States. This cancer is very understudied, especially within Asians and minority groups, and more research is needed in this area. Helicobacter pylori is a type of bacteria that grows in the stomach. It may not cause problems at first, but over time it can lead to issues like gastritis, and eventually, it can erode the stomach's lining, leading to atrophic gastritis and potentially, gastric cancer. Studies have shown that the combination of Helicobacter pylori and a high-salt diet can increase the risk of gastric cancer more than either factor alone. However, not everyone who is infected with Helicobacter pylori will develop gastric cancer. Only a very small percentage of people with this bacteria will actually get cancer. Additionally, Helicobacter pylori can also cause other issues like peptic ulcer disease and gastritis. For many other types of cancer that have high rates, there are specific guidelines for screening. Since a large portion of Asians are first-generation immigrants, and even the second generation still faces a high risk. As a medical professional, I believe it's important for individuals of East Asian descent to be screened for Helicobacter pylori, even though it's not currently included in the official guidelines. Screening for Helicobacter pylori can be done through a stool test or a breath test. If it's positive, a 2-week course of antibiotics is typically all that's needed. So, why is screening so important for stomach cancer? Well, the thing about stomach cancer is that it doesn't show any symptoms until it's very late. This means that by the time you start noticing things like indigestion or unexplained weight loss, the cancer may have already progressed quite a bit. That's why it's crucial to get screened for stomach cancer, especially if you have a family history of the disease or if you're from a minority population, like the East Asian population. In fact, in countries like Japan and Korea, they use a method similar to a colonoscopy called endoscopy to screen for stomach cancer. It's a pretty simple procedure that doesn't require any special preparation, and it can help catch any potential issues early on. So, if you fall into any of these risk categories, it's definitely worth considering getting screened for stomach cancer. When treating minority populations, it's important to have a high suspicion of stomach cancer, particularly in Asian Americans due to the high rates of Helicobacter pylori and gastric cancer. Health policies need to be developed to address this pressing issue.